think we'll go ahead and get started with our final webinar in our New Era, New Opportunities, Making Medicaid Work for You webinar series. We're excited to have you with us again this week. And as you know, this week is kind of our bonus episode. We'll talk a lot more about what that means here in a few minutes, but this is just a recap of where we are in the series. And if you've been with us for all 7 weeks, I'm grateful to you for hanging in, and hopefully you've learned as much as I have. So again, welcome. My name is Tanya Dorfbruner. I'm the Executive Director here at Oral Health Kansas. And as I said, we're very happy to have you with us today. We'll just go over a few housekeeping things and then hop right into the content. The logistics are, if you've been here, you kind of know what these are now, but we are going to be using the Q&A chat box or Q&A box to ask questions throughout the webinar. Do encourage you to put questions in just whenever they come up for you. We'll answer as many as we possibly can. If you do run into any technical challenges or anything like that, please use the chat or email us at info@oralhealthkansas.org. And as always, we are offering CEs in partnership with the Kansas Dental Association. So if you need CEs, just put your name and email address in the chat and we'll make sure you get those CEs. The certificates are going to be sent after the end of the series, which will be here in the next several days after today. And again, you know that this is this webinar is a part of the Pathways to Oral Health initiative. This is a project that Oral Health Kansas has been working with many of our partners on. And of course, it includes 3 different general categories. We're trying to work on strategies to support dental providers to be successful at being Medicaid providers, trying to provide educational programming for dental professionals just like this, as well as for people with disabilities, and then working on communication tools. And we'll talk about that in particular today. I always love to share this little graphic because I think it's exciting to see how many partners are a part of this larger Pathways to Oral Health initiative. And this, I think this initiative kind of grows all the time, but you can see all the many partners, and you've certainly had the chance to especially interact with all of our managed care organizations throughout the whole series. And this series specifically, as you know, is brought to you by the Oral Health Kansas and the Kansas Dental Association. It's funded through an ARPA grant through the Kansas Department of Health and Environment and the Division of Healthcare Finance. Kevin, I think you're here with us. Do you want to say any few words of welcome?
Absolutely. Thank you, Tanya. I'm Kevin Robertson, Executive Director of the Kansas Dental Association. This has been a great opportunity to work with Oral Health Kansas and with all of you and trying to increase access to care for the Medicaid patients and really the citizens of Kansas. So thank you very much for being on, and I hope that you're able to get a little bit out of this series. Thanks.
Thanks, Kevin. And thanks again for your support and for helping by offering especially those CEs for this whole series. I know people appreciate that. At this point, you've had a chance to talk for several weeks now with our dental Medicaid facilitator, Brian Thompson, and with several of our other staff. Today, I'm excited to introduce you to Dr. Mary Ann Lynch Small, who's going to be talking about our agenda for today. She's our Medicaid projects manager, and I think I'm just going to pass it to you, Mary Ann, and let you get us started.
Thank you, and thanks everyone for joining us today. As Tanya was saying, today's kind of bonus webinar, so to speak, is slightly different to the previous weeks. We're going to take a look at another core element of this Pathways to Oral Health project, which is all about improving oral health and oral healthcare access for people with disabilities, including improving communication via a tool called My Dental Care Passport. So we'll be kind of looking into the passport in a bit more detail, how that passport can help you and your team, and then where to find it. And next slide, please. So before we jump into things, we're going to take a quick poll. Tanya, if you're able to pull that up.
Yes. Here we go. Okay, you should have a poll on your screen.
Awesome. So the poll and the question is just on a scale of 0 to 10, 0 being not confident at all and 10 being the most confident you can be. How confident do you feel caring for people with disabilities in your dental practice? And we'll give you a couple of seconds here to think about it and submit your responses.
Give it maybe another 10 seconds or so. Okay, it looks like we've got a lot of good responses. So we'll go ahead and close the poll.
Excellent. So I'm glad to see people kind of going towards the more confident end of the scale, but we've got a kind of mixed responses, which is what we expect to see. So hopefully, even by the end of today's kind of quick 30-minute session, we'll see more people towards the kind of top the eights, nines, tens. Thanks. Brilliant. So before we launch into the kind of details of my dental care passport, we want to touch on the kind of why. Why is dental care for people with disabilities such an important area in dentistry today? And why is it relevant for all of us in the dental profession? So it's estimated that more than 70 million adults in the US have a disability, and that's around 1 in every 4 individuals. And when we say people with disabilities, this is a very broad and diverse group with kind of a vast range of strengths and challenges and needs. And many disabilities are hidden, and you might not be aware that an individual has a disability when you see or interact with them. But what this means is ultimately that you will encounter people with disabilities in your practice and your place of work. And that's true whether you or are not a Medicaid provider. But as we discussed in earlier webinars, in Kansas, Medicaid provides health coverage for low-income individuals, including children, older adults, pregnant women, and people with disabilities. And this group is disproportionately covered by Medicaid. Again, I did want to touch on that when we talk about disabilities, we're not talking about a health outcome or a health condition, but how an individual experiences and can participates in life. And this can include how a person physically moves through the world, differences in how a person's brain processes and interprets information, differences in how a person communicates with one another, and how this can then impact participation in many facets of life, from education and work to tasks of daily living like self-care to obtaining healthcare and navigating healthcare systems. So an individual's ability to participate in these activities and interact with the world around them is also very much determined by how the world interacts with that individual. And many of the restrictions faced by people with disabilities are unfortunately created or sustained by the society we all live and work in, rather than factors solely related to the individual themselves. Next slide, thanks. So kind of through that lens, membership in the disability community impacts how a person interacts with healthcare, but then also how healthcare interacts, how healthcare professionals, healthcare services and systems interact with that individual. In the US, it's estimated over 6 million people with disabilities are not able to access the dental healthcare that they need. And that makes dental healthcare the #1 health need for this population. And we can feel this closer to home. Here at Oral Health Kansas, one of our most frequently asked questions is, where can I find care for a child, and even more so an adult with disabilities? And unfortunately, this is reflected in health status, and individuals with disabilities are found to have higher rates and increased severity of dental disease, like periodontal disease and caries, compared to non-disabled counterparts, which can negatively impact their oral and overall health. You will have access to these slides, and I do recommend going back and taking a closer look at this infographic. So this is a busy slide, but for good reason. It's really highlighting that the barriers to care for people with disabilities are multifaceted and complex. We have things like social stigma and the impact of ableism. We've all been raised and live and work in a society which has historically discriminated against people with disabilities, whether we were conscious of it or not. And these social biases can still impact how we interact with others in our day-to-day life and in our professional life. And how can we as a community and as a profession unlearn these practices and really work to challenge assumptions and destigmatize disability? Again, awareness and knowledge is a big one. Are we as oral health care profession aware of the inequity in oral health faced by this community? And are we aware and knowledgeable about the challenges and needs related to oral health for people with disabilities? Again, provider confidence. It was great to see that many of you were feeling confident, but there were still many people that were kind of in that middle, oh, maybe confident in some cases, maybe not so sure in others. And it does tie in with education and also our desire to do best for our patients. But a lack of provider confidence is often cited as a barrier to care. In communication, which we'll touch on a bit more, it's extremely important. How does an individual communicate in terms of style? Are they speaking, non-speaking? Do they use non-verbal cues? And then on our end, are we prepared to be flexible with our communication and the listening skills as well to meet patients' needs? Again, sensory needs, we will touch on this again, but the dental office environment can be a pretty stressful environment for all of us, but can be extremely distressing for some individuals with disabilities who have sensory processing differences. And this environment, kind of full of new and often unique sensory stressors, can make completing a dental visit very challenging. Of course, the omnipresent barriers, a lack of resources and time. This list can seem a bit daunting, but what we want to highlight is we actually have a lot of opportunities here to make incredible change, and highlighted in orange are some of the changes we can start to make by embracing My Dental Care Passport. So we've got another quick poll here. So this is just about My Dental Care Passport. Have you ever tried using My Dental Care Passport in your practice? Kind of yes, no, and we've got not yet. If it's something that you're thinking about, we'd just love to know if it's something that you've heard of and you've tried.
Getting good participation. We'll just give another 10 seconds or so here. Okay, let's share the results.
Brilliant. So again, a bit of a mix. We've got one person that says yes, that they've used it. Got a couple of no's, and then we've got a couple of not yets. I enjoy the optimism there. So we can tell you a bit more about My Dental Care Passport, why it might help you and your dental team. So let's move on and take a closer look at kind of the tool itself. Yeah. So we've talked about some of those barriers to care. So how can we help break down some of these barriers? So often communication and expectation setting can be that difference. And that's where My Dental Care Passport comes in. Again, just a little bit of background. The passport is a communication tool inspired by an adult with disabilities and his family who were looking for a new dental office after moving to Wichita. And they needed a way to share his individual needs and preferences with a new dental team. And that knowledge that the dental team would already have a chance to get to know him and understand him as a person ahead of time really reduced the anxiety in trying to find a new care provider. The passport has changed a little bit since then. It's over the last 5-6 years now, and it's now in its third iteration. It's been refined and updated with input from individuals with disabilities and their families and caregivers, from dental providers, and from the healthcare system experts along the way. So in a nutshell, this passport is an easy-to-use communication tool. It's designed to help individuals and their families and caregivers voice their specific needs and share that important information that goes beyond a typical medical history form, but really those things that can make or break an appointment. For example, how a person communicates, what they liked in a dental visit, what parts of an appointment might be more challenging, and then it allows the dental team to appropriately prepare before that person even arrives. We talked a little bit about assumptions earlier. This passport also helps reduce assumptions that might be heard upon hearing an individual has a given disability. We know that disabilities are heterogeneous. Even individuals with the same disability can have vastly different strengths and needs and lived experiences. So that passport can help the dental team reframe disability, unlearn some of these social biases we talked about earlier, and encourage us to ask and listen and learn to help make that dental visit better for everyone. In Kansas, my dental care passport is endorsed by all three CanCare managed care organizations and the Kansas Department of Health and Environment. Excellent. So let's take a look. Next slide, please. So we're going to run through a couple of excerpts from the passport. Don't worry, we're not going to just sit and go through everything one by one, but just a bit of a highlight of how this passport can get you kind of thinking and facilitate a person-centered care approach, and how listening to the patient's needs and experiences can improve the dental visit. So the first thing I want to bring your attention to is right up there at the top under the heading "For my dental team." It says, "This is key reading for all staff working with me." We all know dentistry is a team game, and our team is critical to both how an office functions and the patient's experience. And if we consider some of those barriers that we saw earlier, like communication, awareness, even sensory needs, these could be encountered before the individual even enters the treatment room. So taking a team approach kind of helps us support each other in the office and build a collective confidence caring for this population. It does go on to say there that this passport should be used when you talk to me or have a question about me. This passport really helps us be respectful of people's energy and time. We hear from families that it can be frankly exhausting communicating the same information and needs over and over again in different healthcare settings with different providers. And the passport can help reduce the number of times they need to spend relaying their story. Over on the other half of the screen here, the critical section of the passport is communication and behaviour. This little snippet allows an individual to share how they communicate. Remember, even if a person is non-speaking, they're still communicating with you. So without asking how a patient typically communicates, you might be missing direct communication from the patient and perhaps not communicating back in an understandable and an appropriate way. So asking this question ahead of time helps build that trust, build that comfort with the patient. Knowing how a person communicates ahead of time can also help you set expectations with your team and help feel more comfortable and plan how to best approach communication. For example, you might need to increase the appointment time to allow for some speech processing differences, or maybe helps you understand non-verbal cues so you can help gauge how a person is coping throughout an appointment. And next slide, please. Another couple of sections that jump out, one is sensitivities. So sensory needs are common, particularly among people with IDD, such as autism. And those sensory inputs, like the sounds, sights, smells of a dental office, are processed and interpreted differently by individuals with sensory needs and can even feel painful and cause extreme stress. So again, knowing about these things ahead of time can help you prepare the environment or help prepare the patient for coping with this visit. And this doesn't need to be rocket science. This does not need to be extremely expensive. It can be as simple as having noise cancelling headphones available, dimming overhead lights, giving advance warning of changes and with sounds and sights and smells. One story that springs to mind: when I was practicing, I was caring for an autistic child, and he was coping very well with a small restorative procedure, but the whole appointment fell apart as soon as we picked up the suction, and he heard that noise, didn't have appropriate advance warning, and we talked to the mother after, and she said the one thing that really upsets him and causes his distress is the vacuum at home, and he associated that sound with the vacuum and thought that that was coming, and that meant that we had to stop the appointment. We weren't able to finish, temporize, and had to get him back in. Again, if we'd found that out ahead of time, we could have been prepared, potentially had headphones, or prepared him that that was coming, and that appointment would have gone smoothly. Again, over on the other side, dental experiences. My best visit to the dental office was when we don't have to reinvent the wheel. If the patient tells you about techniques and accommodations that have worked well, given that you're comfortable doing them, do them. You can replicate this experience in your office. And then on the contrary, if there's things that have not gone well, try and avoid these things. We know some things are unavoidable at the dental office, but if we listen and set clear expectations and discuss strategies to help kind of mitigate these things and help with coping, you can often successfully complete most, if not all, of treatment in a general practice setting without the need for physical or chemical restraint. And again, on that note, there's a bit down there about sedation. Of course, for some, sedation or hospital care is the safest way to complete dental treatment. However, it's not the first line of treatment for individuals with disabilities as a blanket rule. It's estimated around 80% of individuals with disabilities can be cared for in a general dental practice setting without sedation or only need sedation for the most invasive services. Brilliant. So how can this passport help you and your team? We know that it can provide benefit to the patient, but really it is there to help your team also. And next slide, please. So as we've touched on, it can help raise awareness of disabilities and the knowledge of individual needs, reducing assumptions and reducing misconceptions. And by setting expectations and planning ahead of time, dental teams can feel more confident caring for that individual and meeting their needs. And fostering that trust and building the patient-provider relationship reduces anxiety and stress among both parties, can make visits much more rewarding for everyone. Again, along those lines, there's nothing worse than kind of scrambling during an appointment or seeing that chance of completing that visit in a positive, stress-free way slipping away. So knowing the needs ahead of time allows you to prepare. For example, the sensory environment, like we touched on, talk about behavioural strategies ahead of time and establish each team member's role. And then this big one, time and resources. This preparation can save time and resources down the line, including the chance of running over if the appointment starts to go off track, and reducing the chance of failed appointments and the need for repeat visits like I experienced. So those 5-10 minutes ahead of time reviewing the passport can save hours down the line and also reduce the need for time-consuming and expensive sedation visits. So just a couple of tips for dental teams. Making sure you share that passport with your patients with plenty of time. So make sure you share it prior to the appointment and ask them to return it ahead of the appointment. Gives the family a chance to go through the passport and complete it, and gives you and your team a chance to review it before the appointment. We touched on all members of the dental team reading the passport, making sure everyone that interacts with the patient familiarizes themselves with that patient and their needs. Use it as a way to help develop an appointment plan. This can help you plan out what is going to be feasible during that visit, what things that you need to have there in your operatory, how you're going to communicate with that patient and their family. Again, making sure you attach the passport to the patient records and have it there to review ahead of future appointments. And next slide. So again, some of these tips and a bit more information are all included on some handy user guides. We have 2 guides here, one for passport users, so the patient, their family and their caregivers, and then one for dental providers and dental teams. Again, when you're sharing the passport with the families, it can be useful to share the patient guide with them as well. And then where can you find the passport? So Everything Passport is all one place, and it's at this link here, pathways-to-oralhealth.org/my dental care passport. There you'll find my dental care passport itself. It's in a kind of PDF format rather that can be filled out online, so it's online clickable and fillable, or the patient can print it out and fill it out manually if they'd prefer. The passport and the user guides are available in English and in Spanish. And you'll notice on there that there's kind of an in-state and out-of-state version. The actual content and the passport are exactly the same. That's just related to the endorsement by the Kansas MCOs and the Kansas State Department. On that site, you'll also find a little bit more about the kind of what is my dental care passport and a handy video as well that can be useful to review and to share with patients and their families. So happy to answer any questions about my dental care passport, but I encourage you to go to this site and look through those resources, watch the video and take a look through the passport and see what it can offer you and your team.
Thanks, Marianne. That was extremely helpful. So much good information. I don't see questions yet, but I do know we've got a few minutes left and a few resources I want to share with you. So keep thinking about everything that you just learned and feel free again to put anything in the chat or the Q&A box and we'll be happy to answer those. But just a few resources, and you've seen some of these, but there's a few that are new. First of all, we've been promising you since week one that we would be putting together a frequently asked questions document that would summarize all the questions you've been asking throughout this whole series. So we now have that available. It's in a frequently asked questions on our website, and you can see that link there at the bottom of the slide. We also have a quick reference guide. I'm excited about this one. That's why this is the one screenshot we shared with you. This is kind of a neat little reference guide we put together that has all the basic contact information and details you need for each of the managed care organizations. There's actually two versions of this as well. This is the one version, and then there's another one that actually spells out all of these URLs. So if you just need that version without the links, that might be easier for you. And then the last one is a series of a set of all the links that we've been sharing in all these webinars that you've been seeing. Abby's been posting links in every webinar with lots and lots of information. We know we've been bombarding you with things, so we wanted to compile all that into kind of an organized document so you'll be able to have access to that as well. We will send all of these documents out to you, but we will also have them posted on the dental providers page on the Pathways to Oral Health website. We also are excited to share a brand new flyer that we've been able to put together actually with the help of some really great Masters of Public Health interns that worked with us over the summer. This is a great just little flyer that is meant to be a guide for people with disabilities and their caregivers to help them understand what behaviors or signs might be happening that might indicate that the person that they care about might have a dental problem that needs to be addressed. So this is designed to be shared as a flyer that you can hand out or shared as a poster on your office wall or something like that. And again, we'll share this with you and then have that posted on our website as well. Some of these others are things you have heard of before, but just want to reiterate the opportunity. There's lots of opportunities to continue to help shape the Medicaid dental system in our state. First of all, we'd love to help you have your help advocating with the legislature over the next several months as we try to continue the work to increase the Medicaid rates. We, as you know, got a really nice rate increase this year. We did not quite finish the job. And so there's a lot of work to be done. And it takes a lot more than just one organization like ours to do it. We're going to need a lot of people and organizations helping us with that. So feel free to click on that link. And I think we might put that in the chat too. And you're welcome to join our advocacy coalition. And as we talk about every week as well, we've got a dental provider advisory group. And this is a group that is meets about quarterly, talks about different Medicaid issues, works together to work on lots of different improvements. In fact, this group had a lot to do with the way the Medicaid dental rate increase this year was implemented. We've also, I've shared these links before, and you certainly are familiar now with Brian as your dental Medicaid facilitator, so I won't go too much into detail on that, but you've got those links as well. And again, just our managed care organizations, all three have been great resources and will continue to be great resources to everyone. This week, we are wrapping up not only this series, but our Project Echo series that we've been doing in conjunction with the University of Kansas Medical Center. This is all about building confidence in dental teams to serve people with disabilities. Thursdays, Echo will actually be featuring a Kansan. We'll be featuring Dr. Nick Rogers and his dental team, talking about how a rural dental practice has been able to really make a role for itself in terms of being a provider of care for people with disabilities and what that looks like. He will also be talking about how they use the passport as well. And then finally, well, almost finally, hopefully you're starting to make plans to think about our annual conference, which is coming up at the 1st of November. That first week of November, we'll be at the KU Edwards campus, but it is a hybrid event. And so if you're interested in participating virtually, that is an option as well. And then last but not least, we'd really love your opinion on this series. We would love to know what you've learned, what other questions you still might have, and how we can be helpful with that. So you can either click that little QR code or take the link when we send that link out to you, and would love to have your feedback by next week if we can. This is definitely not the end of this series. We're ending our weekly series for the moment, but we know we'll be back with additional topics as we go. So if you think of other questions you have or other issues you'd love to learn more about, please do reach out to us. Please do respond in that survey, and that's going to help us design additional educational opportunities for you. We are about a minute over our time, but Marianne, I don't know if you have anything else you'd like to share before we wrap up today.
No, I think I just encourage you to come along to the Project Echo series. Even if you've missed the first couple of weeks, they're available and they're recorded, and you get access to all the resources that go along with it. And there will be more to check out on the website if you want to learn more about caring for individuals with disabilities. There's plenty of resources out there that we've compiled in an easy to find format for you.
Great. And I've just been told by our coworkers that we do have one question in the chat. Would the patient be sending the passport link to us, to the dental office, so that they can view it, or how would they view that? Marianne, do you want to answer that?
Yeah, so the patient can either download the passport via the link that is there on the site, or you can have it and download it and send it to them ahead of time, kind of like what many practices do with their medical history forms, so they have it ahead of time. So patient. Yep, so you can send it to the patient, or the patient downloads the form themselves and then they send it back to you completed ahead of time. We've kept it, trying to keep it as accessible as possible, so they can email it, they can hand it into the office, they can mail it into you if they decide to print it out and fill it out manually. So they are kind of the options.
Great, thank you. And we will be adding that to the frequently asked questions. It's a great question. Okay, well, thank you again, everybody. We kept you a couple minutes over, but I appreciate your patience and your time. And thanks again for just being a part of this entire series with us. We will be staying in touch, and please do stay in touch with us and let us know how else we can be of help to you. Have a great day.